Hello, this is Dr. Kevin Connors. I just want to make a quick video about Protocel. Protocel is a common nutritional cancer care / treatment that we use in our clinic that other people seek out. There's a Protocel 23 and a Protocel 50. They're available in our store. And there's often questions because some of the details that you may look at Protocel at other sites talk about being careful with antioxidants, being careful with other things when you're using Protocel. And the reason is that Protocel is actually an oxidizing agent. So it's similar to chemotherapy in the sense that you're using oxidation to treat the cancer, where chemotherapy is an oxidizing agent / a poison. You don't want to use a lot of strong antioxidants at the time you're doing chemotherapy. Well, it's similar with Protocel, and we want to kind of cover that. So when you're using Protocel, now if you're familiar with Protocel, you'll understand there is a very exact time of day that you take the Protocel. You take it depending on which you're taking, either Protocel 23 or Protocel 50, you're taking it 4.5-hour intervals or 5-hour intervals. So every 4.5 or 5 hours, you're taking the product. When you're taking that product, let's say you're taking it at 8 o'clock in the morning, you do not want to take any antioxidant nutritional products at that same time. So it'd be best if you stuck to solely the Protocel when you're taking the Protocel, meaning at 8 o'clock in the morning, it's time to take your Protocel. You take your Protocel. Any other nutritional products you take midway between. If you're at a 4.5-hour cycle, you take it at 10:15. That's when you'll take your other supplements, midway between. So no antioxidants taken at the same time that you would take Protocel. No vitamin C, no alpha-lipoic acid, no glutathione, N-acetylcysteine, curcumin, turmeric, vitamin E, CoQ10, quercetin. There's a few others. Antioxidants that are out there, don't take them at the same time that you would take the Protocel. You will kind of negate the power of the Protocel because the Protocel works as an oxidizing agent and you're taking antioxidants. You could negate the power of the Protocel. Just like if you're taking chemotherapy and you're getting a chemotherapy IV, so you go in at 9 o'clock in the morning and you get an IV of chemotherapy, that's a strong oxidizing agent. Your oncologist doesn't want you to take antioxidants. Well, we tell people don't take antioxidants for 48 hours after you do an IV of your chemotherapy. That's when it's really doing its job. After that, it's damaging healthy cells. Then you get on the antioxidants and you help protect your healthy cells with the antioxidants. Same thing with the Protocel, but you're taking that daily. Just keep it away midway between your doses. That's the secret with taking oxidizing agents and using antioxidants to protect your healthy cells, to help deal with cancer in other ways other than what you're doing with Protocel. Another question we get is with the Rife machine. Some of the older Protocel posts out there will say don't use the Rife machine with Protocel. That's talking about the handheld grip electrical stimulation Rife machines. That's not talking about the light frequency Rife machines, which in my book are really the only type of Rife machines using light frequency. So using a true Rife or a GB4000, something like that, with the bulb, you could use that right along with when you're taking the Protocel. So just understand that. Another question we get is, can you eat foods that have antioxidants? Should I stay away from vegetables and oranges and good foods when I'm doing Protocel? The answer is no. So really what you want to worry about is taking supplements with antioxidants. So if you're going to take Protocel at 8 o'clock in the morning, can you eat breakfast that maybe you're going to eat an orange, or maybe you're going to eat some fruit that's high in antioxidants? I would not worry about that. It can be good to wait a half hour after you take Protocel and keep Protocel away from food at least a half hour. That might be a good practice. But don't worry about eating oranges or berries throughout the day, other foods that are high in antioxidants throughout the day. If you're going to eat a lot of high quantities of that, again, choose to eat it between doses, just like your supplements, and then you'll be fine. You want to protect your healthy cells. You want the Protocel to attack the cancer. So with that in mind, keeps life simple when taking Protocel. You don't have to be crazy about it. Just keep the things away from your doses. All right, thanks much.